I'm just continuing my story, how I developed. Because if you understand how I have developed myself, maybe you can have some example in your life. That's the reason. I don't want some good indication of ipecac, and I gave ipecac 3C. And said after 3 days, let me know. He said, no, you come to my house and you evaluate me. And that day, when I evaluated him, he said, coughing is much better, but I hear a lot of rattling in my chest, even without coughing. And I was thinking, rattling in the chest without coughing, something very unique. Fortunately, I had read a book by Farokh on respiratory therapeutics. And so I gave tuberculinum aviare, 1 and 2 doses, and I said, look, in these 2 doses, the rattling will disappear. And Mr. Birla was so happy that the rattling disappeared. I said, now gradually taper your allopathic medicine and let me take your history. So I took his history and I came to conclusion that he was typical a natrum sulf person, lot of qualities of natrum, lot of qualities of sulfur, very chilly. Bombay has a damp weather, so it was always aggravating his asthma. Then he said, you cured me of my asthma, what can I do for you? I said, open a department of homeopathy. There was no department of homeopathy in Bombay in any hospital. So he was the chairman of Bombay Hospital, a very big hospital. I said, open a department and I will conduct the department. He said, okay. And then we started the first department of homeopathy. I was very happy that homeopathy became popular in my city. The next step was still bigger. We had a municipal commissioner in Bombay known as Mr. Tinekar. Mr. Tinekar was a very straightforward, strict, uncorrupted municipal commissioner. And one of his friends was my patient. And Mr. Tinekar was having one symptom, excessive sneezing and excessive running nose early in the morning after waking up. And he will spend almost few hours using handkerchiefs and tissue papers, and that was very annoying. So he started taking antihistaminic, long-lasting antihistaminic. But then also the sneezing and running nose did not stop. So my patient took me to his office and he said, if homeopathy can help. I said, have you taken homeopathy? And to my surprise, he shows me Silesia, Natramure. He said, I have taken homeopathy, but homeopathy does not help me. Now, this is very disheartening to know. Because I always feel it's homeopathy who is not helping, not homeopathy. And so and he says, only in the morning. He says, once 11 o'clock comes, nothing happens. So I gave him ammonium phos. To read Borix Materia Medica, he very clearly mentioned exactly the case of Mr. Tinekar. And so the bouts disappeared after ammonium phos. And again I said, look, I helped you, now you help me. Open a department in municipal corporation. That's how we started a department of sports medicine with homeopathy. I conducted that department for about 10 years. And then I said, start generalized medicine, homeopathy. And since 5 years, we also started palliative oncology department. So that's how we started our department into public sector, but for municipal corporation. Private hospital I had already started. And then a very golden opportunity comes to me, where I was invited by the Prime Minister to treat his bronchiectasis. Mr. I.K. Gujral was the Prime Minister, and he had a very bad bronchiectasis. And I was called because he gets recurrent infection in the lungs, recurrent cough, breathlessness, lung capacity was very poor. And I asked him, tell me your symptoms. And he says, copious expectoration, yellowish expectoration. And he gave me a very unique symptom, excruciating pain in the back while coughing. I knew my materia medica very well, and I gave him Seneca 1M. And with Seneca, all his complaints disappeared. Then I said, look, I helped you. Now you open a department in Atomic Energy Commission of India. And he said, okay, go to my secretary and talk about what you want for homeopathy. And so we started two departments, Nuclear Corporation of India and Atomic Energy Commission of India. We started homeopathy. Of course, I left all those things because I was very busy with my own practice. But I told them that other doctors you appoint. And then I started a department in Oil and Natural Gas Commission of India. Thanks to the Prime Minister, he was very, till he died, he was taking my treatment for homeopathy. Whenever in the winter, you know how bad winters are in Delhi, with all the fog and everything. So I used to always give him Mentha paper data. If you have boric materia medica, read. For foggy weather, for cough with the fog, Mentha paper data is the best medicine. And he used to always bless and keep that medicine in his purse whenever he had this kind of problem. So like that, I kept on helping people in various sectors of life to expand homeopathy into the society. Today I don't work with many organizations because I want others to work and continue the journey of homeopathy. So this is what I have developed for my future generation. So you all also should have one thing, and that is knowledge. Knowledge is power. Having a big structure is useless. Having instrument is useless. Having books is useless if you don't have knowledge. Only thing, knowledge plus extra things is excellent. But extra things without knowledge is useless. Remember that. And that is why I have visited hundreds of colleges in my life. I have seen hundreds of institutions in my life. And in majority of them it is like that only. Good structure but no knowledge. And that is why homeopathy suffers today. That we don't have that class. So we have to build the quality of homeopathy and not quantity. That's very, very. One good homeopath in Tamil Nadu is equal to 10,000 stupid homeopaths in Tamil Nadu. One good homeopath with an excellent skill is equivalent to 1,000 homeopaths with no skill. And that is why you all students should work very hard. What I saw in your institute is that the environment is very good. There is a lot of seriousness because all those things will make you stimulate to read and study and be sincere. So take full advantage of that. Take full advantage. Because the more you take advantage from your institution, the better homeopath that you will be. Okay? Now, honestly, when principal gave me this topic, Dr. Kumar, I didn't understand the title of it. I know how to repertorial way of modern marvel and homeopathic palliative care. I was a little confused, but I didn't want to disturb him by telling that I am confused and give me another title and this. So I modified the lecture because I understood his intention. And so I made some PowerPoint because I was too lazy, so I only made very few PowerPoints. Most of it is in my notes which I will teach you from. Now the most important thing when you use repertory, it is very important. What I have seen in my life is that homeopaths only see the repertory, what knowledge they have in their mind. What they don't know, they don't see in the repertory. And that brings a lot of failures to their practice. Repertory is an index. You have everything in it. Of course, it's an incomplete index. So you have to keep on broadening every day. But still, it is just an index. Now, how you interpret that index? From physical point of view, it's very easy. Pain in the right little finger. If patient says, you open the repertory, extremities, pain, fourth finger, right side, you see the remedy. Good. It's very easy. But if I say delusion, urinating on the floor, you will not understand that. And you will be a failure if you don't know how to use that chapter of mind. See? So physical is easy, mental is very difficult to interpret in the repertoire. And that too if you are dealing with a palliative care, which I feel the doctor meant was cancer, because palliative care can be in any system of medicine. It is still more difficult. Because when you hear the life stories of